It came out if you averaged out all the process.
All right, well, it's 11:35. Folks can show up before we start. But welcome, everyone. Thanks for being here for the Coordinated Human Services Transportation Plan Kickoff for the steering committee. Appreciate everyone making the trek out here. There's lunches out there. If you guys want to grab one at any point, I think it's sandwiches. But we'll give you an overview of what we're going to go through today. We'll do some welcome and introductions, go around the room, introduce ourselves, our organization. Then we'll give you a little bit of an overview of what the plan and what the process is, some of the roles and expectations for this committee as we go forward through the next 6 months. Our staff will give you a plan assessment of the last plan, which was completed in 2016. Some of you may remember, some of you may not have been involved. And then our team will give you preliminary data inventory and demographic analysis on some of the target populations as well as existing conditions. And then we'll go through some next steps, what we're going to do at the next meeting and upcoming meetings, and get you out of here hopefully by 1 o'clock. All right, so we could just go around the room. Meg, we can start with you. Just say your name, your role, and which organization you're with.
I am Meg Croft. I am an INA resource counselor for the Aging and Disability team here. So under GNRC, we primarily help people find resources in their community, such as transportation. So that's where I kind of come in here.
Right.
I'm Brian Collins, Mid-Cumberland Human Resource Agency. I'm the Middle Tennessee RPO coordinator for our the 5 counties: Stewart, Houston, Humphreys, Dixon, and Cheatham.
Mike Ringenberg, Clarksville Transit. I've been the director for a year, starting next week, so we're almost there.
Taylor Lee, I'm with the NPO here at GNRC, planner, and I do project deliveries. My focus here.
Shelley Northfield, I'm the TIP coordinator, so that's the Transportation Improvement Program at the MPO at GNRC.
Max Baker with GNRC, lead the research and analytics team.
Daniel Caparella, transportation planner with GNRC.
Devolena Devnath Mukherjee. I'm the senior planner in the planning team.
I'm Ashley Onwalker. I work for South Central Tennessee Development District, and I work in transportation. So we provide transportation with SCATS transportation and the Muletown trolley service.
I'm Emily Dukach. I work for TDOT, where I supervise the Office of Mobility and Accessible Transportation.
Russ Brashear, Assistant Transportation Director, Murfreesboro Transit.
Stan Higgs, I'm CEO at TMA Group. We run Franklin Transit in Franklin, Tennessee, and also Vanstar Davenport Regional.
My name is Isabel. I'm a community and regional planning intern here at the GNRC.
All right. Cool.
Hi. Hi, I'm Cole Dugan. I'm the creative services coordinator, designer, photographer for today. Don't mind me.
All right, thank you all. So, oh, I didn't even notice there. Sorry, y'all. Jessica.
Good morning, everybody. I'm Jessica Hill, the Director of Community and Regional Planning with GNRC.
I'm Ashley Glasscock. I'm one of the research analysts that works with Max Baker's team at GNRC.
I'm Tom Fox. I'm a GNRC volunteer.
All right, thanks, everybody. We've
Daniel,
got 2.
can you hear me?
Just realized that. Yeah, Stan and Jill, go ahead.
Yeah, that's just Stan and Jill Hall from Clarksville MPO.
All right, thank you all. Okay, so just a high-level overview of the purpose of the plan. Some of you may be aware, but essentially the plan purpose is to identify the transportation needs of 3 target populations. So individuals with disabilities, older adults, and people with low incomes across our 15 county area. I'll go into the study area in a little bit. Provide strategies for meeting those local needs, both fixed route and on-demand transit service. Prioritize transportation services for funding and implementation. I'll go through some of those sources as well as some of the strategies that we're identified in the last plan, so you all know exactly what you're working with and can provide informed feedback as we go through the development of the plan. So what is Coordinating Human Services Transportation Plan? It's a bit of a mouthful. Obviously, the acronym is a long acronym. But we do this planning process because it's required by federal law. So the bipartisan infrastructure law, the most recent transportation legislation, requires MPOs, metropolitan planning organizations, to prepare this plan to be eligible for the Section 5310, which is Federal Transit Administration funding, Enhanced Mobility of Seniors and Individuals with Disabilities program. We also have another funding program that used to be an FTA fund, Job Access and Reverse Commute program. WeGo Public Transit, since that was discontinued federally, they have every year dedicated their 5307 funds for use within our region as well. So we still have those two programs that this plan guides implementation for. And then, of course, you all will be guiding the development of this plan and the strategies that are outlined to actually improve both on-demand and fixed route service for our three target populations. It's a participatory process. We're going to be looking to all of you to tell us the gaps in service, as well as any other conditions that would be relevant to the plan. This is our study area. So as you can see, 15 counties across both Tennessee and Kentucky, Christian County and Kentucky to include the Clarksville MPO area. The counties in blue are our GNRC development district, as well as the Mid-Cumberland counties that Brian mentioned. And then in green, the Clarksville MPO boundary. We've partnered with Clarksville MPO to do sort of a joint planning process, as this area obviously includes one transportation system for on-demand service as well as fixed route. So what has happened in terms of demographics of population since the last plan? So since 2017, total population region-wide has increased about 10%. The number of people age 65 plus, so those older adults, pretty significant jump. So additional 22%. Number of people with disability, about a 9% increase. Number of people below poverty has actually decreased, so decreased by 8%. And then that total target population has increased by 6%. So that includes at least one of those three target populations.
Do you know what the poverty level was as far as like the amount of dollars that makes it?
It varies. So it depends on number of people in the household and number of workers in the household, I think.
Give like a ballpark of what kind of money we're talking about.
I mean,
I mean,
for you,
I just wondered what that dollar amount might be in this area. Like, is it 30,000? Is it 20,000?
yeah, we can look up what like an average family size would be. Yeah, my guess would be that it would be in the 30s, but I don't know that for sure.
Sorry.
No, you're fine. We can try and get that to you. All right, so since the last plan, a lot has happened in our region. Obviously, we've been through a pandemic, lots of changes associated with that. So wanted just to be aware of those changes and how they impact the services that we're providing through this plan. So changes in travel patterns, increase in telehealth appointments, a lot of the appointments that people need to get to, and there's obviously medical specific service. Working from home has increased. So just being aware of that and incorporating that into our planning process. Impacts to public transit ridership. Obviously, it declined for a number of years, but has somewhat bounced back in our region. Increase in walking, biking, and outdoor recreation. A lot more people are walking and biking, engaging in recreation due to the pandemic. And then there have been, challenges with transit service delivery from a fixed route standpoint, driver shortages. I'm sure on-demand has been experiencing some of the same issues, but service frequency and reliability have also taken a hit. So just being aware of these impacts and how we can keep them in mind as we think of strategies to improve service. And then here are the goals from the 2016 plan. Just so you're aware, they may change, they may not as we go through this process, but improving awareness of services and use of technology to access those services, increasing mobility, accessibility, and ridership through efficient and effective coordination of those transportation services, increasing transportation options for those three target populations, as well as veterans, increasing the number of communities in the region with access to transportation services for those target populations, and then improving the quality of services. Obviously, this takes everyone in this room as well as others coordinating. That's why it's called the Coordinating Human Services Transportation Plan. It takes state agencies, nonprofit providers like Senior Ride, as well as on-demand transit providers like Mid-Cumberland and WeGo Access. So I'll take any questions if anybody has any, but if not, I'll go into some of the roles and expectations of this group. All right, so really the purpose of the steering committee is to assist in establishing and prioritizing goals and objectives for the plan update. So we're looking for you all to be involved throughout the process with monthly steering committee meetings, as well as guide the scope of work for public and stakeholder engagement. We'll go into exactly what that means and what those meetings will entail later in the presentation. Review and comment on draft deliverables. So, existing conditions, strategies, actions, surveys. You'll be involved in every part of the process, and we really value your feedback. And then, of course, endorsing the final draft plan and its policies recommendations for consideration. How does that benefit you as a member of our steering committee? You have access to all of our research and analytics. We have an awesome data team that's going to provide you with a presentation later in this meeting on existing conditions and service information. Participation in regional studies and planning activities like this one, brainstorming strategies and solutions for implementation, and of course, access to best practices and the peers around the room who are experts on coordinated human services. So some of the plan objectives, this is just diving in more specifically to what we're hoping to accomplish with the plan. Inventorying existing transportation services. What are the on-demand providers? What are they nonprofits? Are they existing agencies? What does the fixed route service look like? What does access to that fixed route service look like in terms of, walking or biking there or taking alternative transportation there? Cataloging and assessing the needs or gaps in that existing transportation service across all of our areas, whether they're urban, suburban, or rural. Identifying and prioritizing strategies to address those needs. And then, of course, guiding those two funding programs that are administered each year to actually fund on-demand services as well as bus replacements and others that we'll go into later in this meeting. So these are our current steering committee members, broken it up in terms of role type. So human resource providers and nonprofit organizations. So Mid-Cumberland, Age Well, and Senior Transportation Leadership Coalition. Public transit agencies that offer both fixed route and on-demand service. So South Central Development District, WeGo Public Transit here in Davidson County, as well as regional. Clarksville Transit, Franklin Transit, Murfreesboro Transit. Those are our transit agencies. And then in terms of state agencies and MPOs and RPOs, we've got ourselves, Greater Nashville Regional Council, the Middle Tennessee RPO, the Dale Hollow RPO, Tennessee Department of Transportation, and the Kentucky Transportation Cabinet. In terms of our schedule, this will be about a 6-month process. So we'll have steering committee meeting every month, as well as 2 targeted public meetings. We don't have the details for those yet. We'll be communicating with you as we go forward in this process, exactly what those will be. They'll likely be at senior centers, veteran centers, to access and involve people from each of the target populations. All right, and I'll hand it off to Debelina to go through an assessment of our 2016 plan.
Thank you, Daniel. So this section will focus on the 2016 plan assessment. As we all know that in 2016 plan, the gaps have been identified in 5 sectors, which are information and awareness, geographical, time-based, client-based, and service quality. So if we further dig deep into each of these aspects, we'll see that in the previous plan, they have assessed the service gaps in each of the sectors, the barriers, and then the suitable strategies to overcome the barriers to address the gaps. For example, if we take information and awareness, then we see the service gap lies into the public information and education program, and then having sufficient transportation related technologies, proper coordination among the providers, etc. So where are the barriers? The barriers lies obviously into the insufficient funding from the federal, state, local, as well as from the private organizations, then the large geographic areas, the proper coordination. So the effective strategy would be having a local coordination policy body, then conducting more and more how to write workshops, etc. So if we go to the next one, that is the geographical, we'll see the service gaps lies into the lack of services to the key activity centers and to the industrial parks, having sufficient TODs, that is transit-oriented developments, lack of coverage to the suburban and the rural communities. So where are the barriers? The barriers lies in the dispersed population, cost of services, then the proper coordination among the land use policies, the transportation policies, etc. So the effective strategy would be expansion of the services to the key activity centers and to the underserved or non-served areas, then evaluate the existing land use and develop more and more TODs. For the next one, that is the time-based, we'll see the service gaps lies into the lack of night and the weekend services. So where are the barriers? The barriers obviously lies into the insufficient funding to pay for these additional service hours, then the lack of vehicles, etc. So the effective strategy would be expansion of the services for all the transit, paratransit, and the service agency to include the weekend as well as the evening services. The next one, that is the client-based, the service gaps lies into the lack of accessible services for the target population. Here, the target population means the veterans, the youth and children, and obviously people with disabilities. And there are also lack of infrastructure and accessibility for the cyclists, for the pedestrians, etc. So the barrier lies into the lack of funding for capital expenditure, as well as lack of programs and information for the low income customers. So the appropriate strategy would be expansion of the services for the targeted population, as I already mentioned, which are the people with disabilities, youth and children, and the veterans, and then identify the gaps and have proper recommendation to improve the accessibility for the bikers and the pedestrian, etc. The last one, which is the service quality, the service gaps lies in the low frequency of services and the having insufficient number of public transportation vehicles to provide the services. So the barriers lies into the lack of funding for the vehicles, then having diversified services. So the effective strategy would be expansion of the fixed route and on-demand services, as well as having sufficient funding to purchase the vehicles to increase the services. So these were the overview what already has been done in 2016 plan regarding the service gaps and their barriers and their strategies. Now off to Daniel to shed more lights on the plan implementation and after effects.
Right, thank you, Develina. So what does that look like in terms of funding? If those were our service gaps that we had identified in the 2016 plan, what have we done since? So the best information we have is related to the MSID and JARC programs that I mentioned before. We go through an annual call for projects for those and award those out to nonprofit providers and on-demand service providers to actually fill the gaps in transportation services for our target populations. So this is our MSID Enhanced Mobility Services. These are our fund requests. So this chart In blue is the requested operating total. So the grant program separates requests based on operating needs and capital needs. And then in orange, you'll see the requested capital total. And then the line going through is on both is the available operating total and the available capital total. So really the takeaway here is that there are more requests than we have available each year. There's just over 5.6 million available for this funding source over those 6 years. So less than $1 million each year, which, as you all know, is not enough to deliver the type of service that we need to be delivering. And then here is our JARC funding requests. Same key takeaway here. In gray, you'll see the available total. So most years we don't have enough to meet the requests. Typically, we give and WeGo gives partial awards to each organization that applies. But as we know, whether it's bus purchase and replacement, staffing needs, or any other improvements related to transportation service, there's not enough money to go around. So those funded improvements throughout the last 6 years can be on-demand operations improvements, vehicle purchase and replacement, new buses, new vans, more accessible equipment, staffing and administrative needs. A lot of the on-demand providers are nonprofits and really need these two programs to make sure that they can operate each year. Expanded service to new counties or other geographical areas, trip planning, technology improvements. We've had a couple awards to develop an app for folks to use in those target populations to actually schedule trips, and accessibility and station improvements on both fixed route and on demand. So really, we just wanted to show you what has been done since. We don't have the best way of categorizing exactly how performance has gone. Has on-demand service improved? Has it not? And so that's what we're going to be looking to you all to tell us through a survey, which we'll go into a little bit later. But first, I'll hand it off. Well, I'll start and introduce Max Baker on our data team to go through some of the existing conditions of our target populations and fixed route and on-demand service. So he'll present existing conditions of those services and demographics, discuss some of the trends that we're seeing in our region, and then we'll talk about identifying some gaps in existing information to guide the development of a survey for you all.
Awesome. Thank you, Dan. And we got a data analysis and training. Jessica sent me the example that is online for poverty. We've got 2023 poverty threshold for a family of 5 members would be 37,000. So 5 members is a pretty big family size. We'd probably be lower 30s would be my guess.
I thought I was in trouble when I heard my name. I had flashbacks to high school. I was paying attention. I'm paying attention. Thank you.
Yep. All right. First, we're going to take a step back from the target populations and look at just those that are in need. It's a little bit washed out, and I apologize for that. Probably the screens, you can see it a little bit better. But essentially, this is the density of households that do not have access to a vehicle. So Carlos households, there's almost 40,000 in the region that do not have access to a car, so would be transit dependent, whether that's fixed route or on-demand services. This is regardless of whether or not they're in a target population. When looking at the proportion, so this is the percentage of the households within each census geography that does not have access to a car. The ones that are showing up here are the ones that are significantly over average across the region. Not really a surprise here that they're going to show up in the urban areas for the most part. This pattern is similar to what we'll see in poverty as well, but you do see a couple that are popping up outside of the traditional urban areas. Looks like Westmoreland and areas outside of Hopkinsville seem to be showing up, and then mostly outside of that, it's going to be the county seats. Similar analysis. Now we're going to isolate for each of the 3 target populations, this being
people over the age of 65, over 300,000 people regionally, and follows a very similar pattern to urbanized area or where most people are living, with areas of focus being in Nashville, Williamson County, Rutherford County, Montgomery County. Looking at the proportionality, it's drastically different. So there are more people in the urban areas, so it makes sense that you're going to have more people over the age of 65. But when you look at concentrations of people over the age of 65 compared to everybody living in that area, it's really heavily focused on the rural portions of the region. Similarly, looking at disabled population follows that same pattern that we saw with the others. But once again, proportionality, much more focused on the rural areas. I think what this will hopefully be sending off light bulbs in your head is that these are not close to where our fixed route services currently exist. And poverty, same thing. So over 240,000 people in the region are below that poverty line and are in areas where there are currently a lot of people compared to the proportion of total population. It is much more heavily focused on those urban areas and traditional downtowns. Ooh, boy, that really washed out on that. Definitely look at the screen for this one. This is the I think an important slide to understand is that each of these three populations does not exist on its own. There is a lot of intersection between them. 1 out of every 3 people regionally fall into at least one of these categories. And of that combined target population, 22% of those have more than one category that applies to them, which is a pretty significant amount of people in the region. So similar analysis to what you saw earlier with each in isolation. This is the complete picture of the total target population. So this would represent all 3 of those circles in the Venn diagram together. Density wise, definitely shows up like you would expect it to, going out to the urban areas. And when looking at the proportionality to the rest of the population, going out to more rural areas. So we thought it'd be interesting to compare this to existing fixed route service, looking at fixed route service in the region, isolating the stops out for the regional services because you don't have the ability to stop at any point along the line, but have fixed stations for those particular services. Looking at how that relates for carless households or those that are dependent on transit for mobility. Those areas that have the most people in the target populations. And it was really interesting to find that 56% of these target populations do not have access to fixed transit, fixed guideway transit. So I think that becomes even more evident when looking at the areas of the region that are predominantly these target populations. They really have to rely on on-demand services or their family members or friends to get them to places that they need to go. And with that, I'll send it over to Daniel, but I'll have to take any questions.
Yeah, just a real quick question here. Max, would the express routes that are offered, the Dixon route and the Clarksville route, for example, will that find its way into this update since they have ridership?
Correct. You probably can't see it on that one, but if you look on the TV screen,
Circle for the transit stop.
yeah, there'd be circles for the transit stops. And it's probably pretty hard to see from where you are.
Okay.
There you go. You can see one. If you look, we'll go to Stanton's
I see the
territory.
one
See right below
Franklin.
Franklin Transit.
The one in Dixon, I see also.
Yeah, there you go.
Yes.
There's one in Dixon.
We'll get these slides sent to us.
Yes, absolutely. But I think, do you have another question, Brian?
Yeah.
I think one of the key takeaways is we have a good way of mapping fixed route service, but it's pretty difficult to map all of the different on-demand service providers in the region. Some are only for specific target populations, some require specific medical insurance like Blue Care. And some, pick up in some counties, drop off in some counties, but this is sort of the best that we could come up with in terms of on-demand service providers to sort of match with our target populations, what's available. So I won't go through every single one of these, but as you can see, we've got people with disabilities, people in poverty, older adults, and then we added in military veterans as well as insurance and non-emergency medical care transportation. Some of these are regional, some of these are county specific. Like Portland Adult Transportation only offers service in Portland, obviously Mid-Cumberland. And some of the medical providers are some of our more regional. They offer service in almost every single one of our counties in our study area. But I think that the takeaway here is that while there is existing service, it may not be available for everyone based on which target population you're in the community of, but it's also difficult to access. We don't have sort of a go-to list of services that people can understand. They may not know a service exists, or service may not go to their county. So sort of what this planning process is for is to identify the gaps in those services and have you all tell us, are we missing any of these on-demand service providers? Are there counties that some of them do provide service in that we're not aware of? And sort of what's the on-the-ground conditions? Are people having to wait to be picked up? Is it difficult to get a ride in the first place? So I know your team went through a planning process a couple of years ago to identify some of those gaps and actually spoke to members of the public as well as these on-demand providers. So this is sort of continuing that effort and better understanding the gaps in service. Oops. So some of our key takeaways overall that we are aware of at this point. Service needs and demands are increasing as the population grows, as more people move here, as more people age or become disabled. They need access to transportation to get to their medical appointments, to get to the grocery store, to get wherever they need to go. Funding to assist with these unique transportation needs is limited and costs are increasing. Our two funding sources have not been necessarily increasing in available funds, and there aren't many other dedicated sources out there to help assist with the needs that the service provides. All of our target populations are limited in their income and spending power. Not everyone can take an Uber where they need to go. And if they're in a rural county, an Uber may not even be available in the first place. Fixed routes may not serve all of the destinations they need to go. And obviously, you saw the map that Max showed. Even if there's a regional route, there may not be stops along the route that people can access. And then each target population has unique needs. Folks may not have access to a safe sidewalk or travel to a transit stop. So we're trying to take that into account. And then, of course, public transportation is lacking to help target populations get around other than driving between on-demand and fixed route. So in terms of next steps, what are we looking for from you all, and how are we going to go through the development process in this plan? So we're going to be developing a survey of transportation providers and users that we'll be sending to you all for feedback. We'll have two targeted public outreach events, as well as monthly steering committees. And they'll be working with our aging and disability staff to notify target populations of engagement opportunities and send out the survey for users to identify gaps in service as well. Here's just a schedule of those meetings. So our steering committee meeting number 2 will be next month. We'll send out more information following this meeting, hoping for a targeted public kickoff event in April, another steering committee in April, as well as another targeted public outreach event. So we'll be in contact with all that information, but don't want to overwhelm you too much today. So as I mentioned, we'll be sharing some of the data and slides that we presented today. And some of the details associated with that, as well as disseminating the transportation provider survey so we can get more feedback on exactly what you all think the gaps in service are for your various services. And then here's just a link to our dashboards that show some of the data that you saw today. I'll take any questions at this point, but that was a lot of information. So I understand if you want to review it on your own time.
I have a question.
Yep.
So does any of what we're doing relate to the referendum, the transit referendum?
Somewhat. Obviously, that's an opportunity for dedicated funding for transit services. So yes, it does relate. I think that this is also sort of more of a additional planning activity to figure out sort of the subset of that transportation service for these specific target populations, whereas the referendum is sort of like an overall transit needs activity. So we'll keep our eye on exactly what's happening and share information as we have it, but yeah. Any other questions?
Yeah, I got another one here. Will this plan update require any kind of formal action from agency board or in my case, the RPO? A letter or maybe even a letter of support at a minimum.
I don't think I know it'll require adoption from our board, and I guess from the Clarksville board as well. I'm not entirely sure if it'll require adoption from each of the RPOs. I'll look into that and get.
I guess I should pull that part back. We would certainly be favorable to a letter of support when necessary, like going after a funding opportunity. But if this is something that needs to go before Mid-Cumberland's HRA board, then I can pass this along to Jane.
Right. That's a good point. We'll get back to you on that one, Brian.
Sorry, so you're asking for the Mid-Cumberland board or for the RPO?
Well, actually, I pulled back on the RPO action, but we would certainly be, I would certainly be favorable to a letter of support if one is preferred or necessary.
We're happy to present to the Mid-Cumberland board as well, if that would be helpful.
Sure. I can fight you on the RPO agenda of the future. You come give.
All right.
When you're talking about the funding, and I should know this, I apologize, is that funding 100% funding for out of those programs, or what are the matches on those?
I believe it's 80-20.
80-20 operational too, or just?
Oh, it depends on, yeah.
Well,
For operating.
if you had state assistance, it'd be 70.
And then I'm just curious, like from like a Mid-Cumberland type, folks that are looking for that kind of transportation, what are they paying, and is that all the revenue that comes in if somebody needs a ride on the Mid-Cumberland?
Well, I'm not informative as far as the finer details of how we deal with clients, except that it's first come, first serve. You make an appointment and schedule a pickup. That's about all I know.
I don't remember Mid-Cumberland's fare, but all the HRAs have fares under $10. Those fares do provide some program income, but they're not funding the program. Most of it is FTA funds. So public transit funding.
I think Mid-Cumberland is $350 for a one-way trip. But
we contract with Mid-Cumberland to do our paratransit service in Murfreesboro. And it's twice what the fixed fare rate is. So they pay $2 one way. And it's different than they have to follow, we have to follow the FTA requirements for paratransit service. So, there's certain reservation requirements, there's, missed trips requirements, there's a whole slew of things that they have to do different under our contract than what they would do, in other counties and so on. So.
I know you mentioned in your presentation, like pedestrian, bike. Is that a big part of what you see that are the needs for this group?
Yeah, I think especially in the urban areas, providing safe walking and access to either fixed route or pickup service.
Have an ADA transition plan.
As an MPO, no, but all of our locals do. Yes. And all the transit agencies do as well. Are there any items that we're missing that you'd like us to look at that we did not present today?
Are we concerned at all about temporary disabilities? I feel like we've gotten a couple every once in a while calls from people looking, for that type of service, but they're only disabled for, temporarily.
I know that ties in a lot to just medical service in general. So I think it's something we could consider. I think that's a good point.
Because I know you have to, usually apply for these programs, so the application process can take up a chunk of that time where it's needed. So that's just something.
I think the disability information that we presented today is all categorized in the census, so those aren't temporary disabilities. Is that correct?
No.
Yeah.
Bless you. So on the awareness, and if this is coming later, you can tell me it's coming later, but like, so the overall awareness programs in all these different counties, who oversees that? Does that go to the individual counties, or is that something that's more central on strategy for bringing awareness to how folks can use the transportation, things like that?
I mean, I think that's definitely one of the gaps that we've identified, but the INA team has a hotline. I don't know if you want to talk about that, Meg.
I mean, yeah, we kind of get on the ground information for what people are looking for and needing, like that temporary disability, that's one of the calls we'll get. I don't know if we're going to be the best place for, the data technically, because we're only getting a certain portion of the population that's not already aware of what's out there, and we're educating them on them. So it's kind of like a little piece of the pie, but not the full spectrum. Does that kind of answer your question? Yeah.
The only other thing I was gonna mention, I know you probably swear at me that I can't get data back to you quick enough or get it all to you. And part of that is because for most of the transits, it's been in such a flux over the last few years with kind of procuring what most of the agencies are using, going from what was route match to now they got two choices, which is choice one and choice two. And so what's happened in our industry is lots of companies have been purchased, consolidation. We don't know which software they're going to support. Like Route Match got bought out by other companies that consolidated three, but we don't know which software they're going to. So I think it's an opportunity that, like, when it comes to like really grabbing the data, which I know you're quite capable of doing, that talking to the agencies right now, because they're all right in the process of a whole bunch of them, at least, of flipping over to new software that they'll be using. That we all need help when it. We can get GTFS type stuff for like fixed routes, but when you start asking us details on the demand response and how that works, we're way over our heads. So, getting some help on, either setting something in place that will assist you as we bring on new systems. Like I haven't brought on the new system yet, just because I'm waiting for some other stuff, but I think Mid-Cumberland did. a couple of the other agencies have done that also. So it might be a good opportunity to talk about technologically how to better connect, so you're not having to call us 5 or 6 times. You just can't get to it, or we don't even know what to give you. So it might be a way to bridge the gap so that it's way more efficient, as we move forward.
Yeah, you weren't the only one that was having issues getting us the on-demand service, pickup locations and drop-off locations. But I want to have a clear understanding. The issue on your end is not understanding the software that you're either using now or will be using enough to export the data. Is that what I'm hearing you say?
So, I mean,
Okay.
in some ways, you got to look at somebody like us that, we got X amount of people, and we pretty much have to wear at least 4, 5, 6 hats, right? And although I think that services are getting smarter, like what we had in place under Route Match was so overdone, so overcomplicated. It was really difficult just to, what would seem easy to you would seem like we're not sure exactly what you need, what you want, and especially on the demand response. So I think that just kind of keep that in mind, is that needs to be, I think, a better connection between, GNRC and all the transit agencies. A lot of the nonprofits might not have the software at all.
Right.
And I think that's also a problem. I think that there's an opportunity when we write these contracts to help the overall flow of data by allowing some of these nonprofits to get access to software that can really help their operations, and in return, the accessibility for customers and also the accessibility of data. It's really don't sweat off our backs to write contracts and then talk to the vendors and say, we want to, provide extra hardware or software for these vehicles. They're part of this program, and we just negotiate that. We just tell them we need that for our area. And that would be a significant improvement from a business standpoint for these nonprofits to operate. I'm old school. I belong almost in this category of needing help, right? So years ago, none of us could operate equipment like we can now. We didn't know where our buses were. We had no idea how fast they were going. We didn't have any of these things in place. And to make an investment for a nonprofit or even private motor coach companies, we wouldn't make the investment back then because we didn't have the margins to even afford that software. So I just think those, like a whole technology, like what could we do as a group, plus what could we do to maybe leverage some of the buying powers that we have through, because we're purchasing most of these things through TDOT or through federal funds, to give access to these same partners and contribute, maybe in different segments, but they still contribute. And then you'd have much better data, and we would have, better relationship with them because we're kind of using the same type of software potentially, things like that. So just the item to throw out that maybe.
No, I think you make a great point there. I think that was one of our major struggles, was trying to figure out where the pickup and drop-offs were, even for the agencies that provided really good information. It was still putting it, we'll say, at the address. And so you would have a bunch of drop-offs on a major roadway, thinking that maybe like the radiator shop was the address it was pointing you to, but actually it was the Walmart that's behind the radiator shop, which is where they were likely going.
Yeah, because all mapping is different. That's something I've learned over years. I just thought, well, if I give them an address, that software is going to hit the address. Well, I learned pretty quick. No, they don't hit the same address. Depends on what mapping, they're using. So that kind of like just normalized structure, I think could go a long way.
No, that's a really good suggestion.
And the technology companies that have survived the pandemic are pretty strong. That these times are good times to beat out, or the ones that were just not good enough. The ones that are left, some of those partners are really pretty strong, and they have really good software. That I would think we should be able to, to work with those vendors, get that worked out.
And we'd be happy to participate on any of those discussions anyway. So
apologize in a public hearing to you, because it's not like I don't like hearing from you. I'm just like, oh dang, I can't stop everything, trying to figure out how I'm gonna get route match to assist us to talk to you.
Well, and we know when we request it that it's not always gonna be there, so
Yeah.
we understand that. And I think that's a really significant element of this plan process is identifying
Yeah.
strategies just like that.
And as a rule, you know, you tech folks talk the same language. You know, I think as a rule, we should figure out like, you know, who are our either our IT vendors or who are our support people in these technology companies that they've got the state contract, for example, and you'll get it done so much quicker if your tech person is talking to either our tech person or the actual vendor to say, and you have permission to get that information. It would just be a lot quicker and you'd be not frustrated at all. Right.
In other words, leave him alone.
No. I want to get, I feel bad. That's why I'm going through this long. But, and I know it's important, but it's just that, you know, that, and my vendors that do our IT don't necessarily work, you know, on the software. So, you know, I think part of what we can do is just set up a standard that we talk to our software companies that are handling our demand response, whether it's, you know, I don't know, Ecolinks, they one of the companies, and then, or, you know, if we get something with VIA, we just put that in our contract that you're our local representative for, you know, the GNRC, MPO, and we need a contact so that.
Yeah, that'd be very helpful, very helpful. Because a lot of our curiosities, they did come from what types of trips, like where are these people going? What are they needing? But then also, are they being served by areas that fixed transit is already serving? They just don't have that door-to-door service that they need. Or, you know, what it would just help us identify what that barrier is to using existing transit services.
I think it's key, you know, I think that's the key is figure out, you know, when we were trying to push people back into getting on transit, because I think one thing also that was necessarily missing is, and it's an emotional thing, so it's hard to deal with, but safety is a huge concern. You know, and whether it's safety coming out of COVID or it's just safety because you watch the news, you know, seniors, people with disabilities are very, very vulnerable people. So, you know, I think one of the things that we have to consider is that how many vulnerable people do not use our services because they're scared to get out. And I don't blame them. So, you know, what we ended up doing was exactly, we just sat down and said, what is everybody who is using it or has used it, what are they doing? And because we really felt like we had to put the idea in their head that, hey, you can go to the grocery store. It's on this route. You can go to, you know, this, you can go do this, you can go do this. So I think it's super important to, you know, get into the head of your customer and say, well, what would they do? Do they want to do, or they have to do, or they'd like to do? And in reality, you know, in Franklin, it's not like it's a dangerous city, but they are safer when they're with one of our drivers, because we're not that big, you know, that they actually know who the driver is. They know their names. They get associated pretty quick. So whether it's fixed route or, you know, a demand response, I think that's something that we might have to leverage, or through an awareness campaign, say, you know, this is a safe way to get to, you know, the grocery store and things like that. So we just did that whole marketing on all of our social medias, like what do they need to do, what do they might want to do, and we just put the idea as much as we can into their heads that you can do it.
Right. And I think that's the kind of qualitative information. I mean, I remember in your process that was the most helpful, because it not only told providers, you know, you're not meeting our needs. This is how you're not meeting our needs. I'm scared to ride fixed route transit. I'm also scared to, you know, schedule an on-demand service. And I think that was like the most meaningful information I heard in that process was the actual on the ground conditions that you can't find through traditional, you know, quantitative data sources. So.
Well, I had a thought from the TDOT perspective. So we're administering the 5310 program in the rural and small urban areas. So that's a pretty good chunk of that map. And for TDOT right now for 5310 funding, that's going to be restricted just to accessible vehicle purchases and mobility management. But I know just funding wise, I think we've seen maybe a 30% increase in our 5310 funding from the FTA, but we've seen about 100% increase, a little more than that, in the price of vehicles. So we're not even caught up. Actually, we've lost money. So it looks on the graph like there's more, but in reality, we have even less ability to meet that demand.
Right. Yeah, we're seeing the same thing in the urban areas too. You know, a lot more partial awards than there used to be in terms of meeting needs, and I would say especially from the vehicle purchase standpoint.
And well, we don't even have that operating pool, which I know is very popular
Right.
out for us, and we're still not able to meet the demand.
Right. Well, and that's how a lot of our nonprofits are, you know, staffing their operations. So, yeah.
Are there issues getting the equipment right now? I know with other large vehicles, I've heard similar things.
So we have a statewide contract available, 234, it's going to be for minivans, vans, and then like small cutaway buses, less than 30-foot buses. And we actually had, the last one went through 2023 theoretically, but we weren't really able to order vehicles off of it near the end there. So we had to completely re-procure, set up a new statewide contract. I know the agencies have been able to place orders. TDOT has not been able to place any orders yet. 'Cause it's a little different from the state side of things. But I don't think we've seen anything come in. I'll say that.
I think it's safe to say we had a 3-year drought on purchasing vehicles. And then like at the last TIPTA meeting, agencies had placed orders through the state contract. They were told it'd be 3 to 4 months. Some it's going to be 3 to 4 months to 6 months, but some got them within 6 to 8 weeks. So it's just a matter of, you know, at what point will this start to stabilize again? But when you're 3 years backed up, you know, it's really difficult to we rebuilt a bunch of equipment, you know, so, you know, I think everybody's kind of gotten through it, but then, you know, we had just as many issues finding drivers.
I have about 120 vehicles to order, so we've got a pretty big backlog on our side.
Well, then just the prices alone. We had $600,000 to buy 12 vans 3 years ago, and we just bought off the Oklahoma contract 6 vans for $550,000 for the exact same thing. So we haven't even tried a state contract with Tennessee yet because we couldn't find anybody that had any. So we're struggling with that. The ones we bought weren't perfect, but we were having 300,000 and 400,000 miles on vans. We've replaced engines, motors, and transmissions on multiple times. And our bigger problem is not so much equipment as drivers. I mean, it's every day we're 10, 11, 12 short, which is a sixth of a staff maybe. So even if I had the equipment, I couldn't run it. So this is going to be all neat information. But at the end of the day, if I don't have drivers, I can't run new equipment or old equipment. And I can't take over the county or take over the city if I don't have drivers. So we're struggling with that. I'm working with everybody I can in Montgomery County to try to figure out how to get the next driver. Can we share them? Can we steal them? Can we poach mid-Cumberland drivers? Whatever it may be. And right now, the answer is 0.
Is there no interest or are they not qualified?
Both. We've had, out of the last 10 interviews, 7 of them not even show up. Just we schedule them, we get them all prepped and ready to go, and then show up for the interviews. We've got them not even showing up to drug testing now. This goes anywhere from accountants to drivers to supervisors right now. They're just not showing up. So it's kind of a whole new thing for us where you take the applications, you call them. 1 out of 3 don't call you back, so that's off the list, and you go to the next 2 and you schedule them, and then 1 out of those 2 won't show up for the interview. So we're looking at reducing routes again because I can't cover what I have. Even though our paratransit has gone up, we were doing 150 rides a day paratransit, and now we're pushing 220 on a good day. But I don't have the staffing or the equipment to run that one, so we're running 2 shifts and trying to keep the vans running for 12, 13, 14, 15 hours type of thing. So it's multiple problems. It's just not equipment. It's just not drivers. It's a whole lot of stuff because we're backed up 3 or 4 years now worth of equipment. we haven't bought in the last couple of years. So this is gonna be neat to show us. I like to see the slides so I can kind of overlay it with where I'm at. But the fix is gonna be tough. I mean, even if we lay out, here's the 5 silver bullet things we've got. How do we get there? That's a whole nother problem, I think, I mean, is it money? As we throw another $1 an hour, $2 an hour, $3 an hour at them? I don't know.
Social media likes.
Well, so I think, it might be, ultimately you're running a business to be able to help people, right? So I think that like, maybe you'll hear it from me is a lot, I've already started, is what is it worth financially for some of the, especially the rurals, to carry that passenger as opposed to somebody that they can make more money at. I think that's a generic weakness of our rural, whether it's for an employment or whether it's for seniors disabled, the cost to operate the program and the return that you get from any type of subsidy or fare is going to mess with somebody's mind when you're trying to run a business and keep all that going. The second thing, and we've weathered the storm. We're fully staffed now. In fact, I'm a couple drivers overstaffed on purpose because I've been understaffed for so long. But we do strategically, like we run 12 plus 2s, so 12 and 2 wheelchairs on every vehicle. So it changes. I don't have to have a Class B driver for that equipment. And I can't tell you what happened to us, but I want to say in the last 90 days, it just freed up from getting like nobody interested to hiring 10 drivers. So, I think economically something's changing, at least in our area. And so that's a positive. But most of what we do is, we're prioritized on taking care of the customers, but we're also thinking about how do we run this business. And it's different for an urban, versus rural versus somebody like us, which, is, we're not really a small transit, but that's the way most people look at us as a small transit. So I think it's important to kind of, we had discussions on, employment, and, nobody's incentivized to do employment transportation in the rural areas, in my opinion. This is my opinion, because they can make a lot more money and they're addicted to healthcare type, or they can get more money per person to transfer people as opposed to just pick up somebody that needs to go to a job. It's a different fare. And I think those are the issues that Tennessee has to kind of take a look at on being able to use some of our other federal dollars to supplement, give incentive, give, subsidy, for a better word, to help some of these folks that they haven't been interested in moving in the past because they were concentrated on health transportation. And we need to be able to help them diversify. So an employment transfer is just as important as medical. It's just as somebody with a disability that, just needs to get someplace else for a job. So it's complicated, but it's fixable.
Yeah, I think my response to that is, in this process, let's get creative. Let's come up with solutions that are not entirely based on the limited funding sources that we have. And I mean, it's like you said about the technology component. I think we've probably got some strategies that we can employ that are more low-hanging fruit than, convincing more people to become drivers, or, extending service to a county that doesn't currently have it. Obviously, those require lots of capital expenses, but, solving other coordination aspects of delivering the service, can make a big difference. So. Any other questions or comments? All right, well, I appreciate everybody's time. If there's anyone that you think should be involved in the process that is not currently, so on your handout with the agenda is our list of hearing committee participants on the back page. Not everyone is here today, but if there's somebody on that list that you think needs to be on it, please let us know. Otherwise, please take a lunch as you go. We have a lot of them. So, all right. Thank you.